Madison, Bacca, and she is from Mayo Clinic, where I go, so I happen to see a different audiologist, but she's there as well, and I'm sure the program will be interesting for you. Just a comment before I start. In the back, there is a sign-up sheet if there are people who are interested in meeting informally, like with me, to just talk about issues that go on with people who have hearing loss. We could start a small group or just start with one meeting and talk about issues, but I'd just like to be able to see other people, because I know it's difficult for people to who have hearing loss to get through all the things that happen. Let's go over the program first and look forward to that. Madison, thank you.
Adjust my volume here. Testing. Are you hearing me through that microphone there? A little louder? How about now? Testing. 1, 2. Better? Okay. If it at any point gets too soft or falls off my ear, just let me know. So again, my name is Madison. I am an audiologist at Mayo Clinic. I work primarily with adults doing the hearing tests, and then I also work in the kind of vestibular balance lab, which is for people with dizziness, balance concerns. So while I don't currently work in the hearing aid or the cochlear implant office, I've spent some time in those areas as well, so I have some information for you. Today, as you might have guessed, we're going to talk about hearing loss. To start, I think it's kind of handy if everyone just kind of thinks of your favorite sound. Kind of brainstorm what's something that every time you hear just kind of brings a smile to your face. What do you enjoy? And then think about how sad or frustrating it might be if you can no longer hear that favorite sound. For me, I really like the sound of rain, thunder. I also really like the sound of my cat when she's purring on my lap, things like that. Other times people tell me they like to hear their grandchildren talking, their spouse talking, sounds like that. So kind of keep that in the back of your mind when we're going through some different things today. I'm going to adjust this just a second here. Is that any better on this side or about the same? Okay, perfect. So to start, I just want to kind of think about just hearing loss statistics. It's much more common than people always realize. Hearing loss is actually the third most common chronic health condition in the United States. Third to heart disease and arthritis. So lots of people have trouble with eyes and vision. Hearing loss is even more common than that. Over 48 million Americans have some degree of hearing loss. Most types of hearing losses are permanent types of hearing losses that aren't something that a medicine or a surgery can fix. But there are some kinds of hearing loss that can be treated with medications or surgery. We'll get into that. On average, once somebody starts to notice some difficulty hearing, they wait at least 7 years before deciding to pursue any kind of treatment. Sometimes more, sometimes less. And only about 20% of people with hearing loss who could benefit from hearing aids actually use them. And there are a lot of different reasons for that, which we'll kind of get into as we go here. We're going to start with an anatomy lesson. So, this is your ear. More to it than meets the eye. The way that sound or hearing works is that sound waves in the environment kind of get funneled into your ear through your outer ear, which is called your pinna. And it goes through your ear canal and vibrates your eardrum. Let me see if I can get my first drum. Alright, so eardrum here. The eardrum vibrates, sends the sound to these 3 little bones in your middle ear. Fun fact that these bones are actually the smallest bones in your body, and all 3 of them can fit on a penny together. So those bones all kind of vibrate vibrate together and kind of help to amplify, to increase that sound and push it into the inner ear here. This inner ear, this kind of snail-shaped thing, is called the cochlea, and that's where most of the hearing happens. This is kind of this fluid-filled chamber that has a bunch of little cells inside, and these cells are called hair cells. They're not like the hairs on your head, but they kind of look similar, which is where their name comes from. And the way those cells are organized in that ear is they're kind of organized by different pitches of sound, kind of low, deep tones down to really high, squeaky tones, kind of like a piano keyboard that's been rolled up. And as the sound waves, or the sound kind of goes into the ear, it creates a wave with the fluid of the ear. It starts to activate these cells. On the cells are these little tiny kind of hairs, is why they get their name, that then kind of get moved with that sound wave, cause an electrical impulse, sends it up to the brain, which we interpret as speech, music, rain, cats purring, things like that. That's kind of your brief rundown of how the ear works. Now we'll kind of jump into, okay, what happens when something's not working right in the ear? There are a couple different types of hearing loss that can happen. One of them is called a conductive hearing loss, where the issue is actually not in that inner ear, but it's somewhere before there, where something in that outer ear, the ear canal, the eardrum's not working. This can be caused by things like too much earwax blocking the ear, an ear infection, you get a little hole in your eardrum, issues with those bones in the ear, or issues with this eustachian tube that kind of connects your ear to your throat. You've all probably experienced where you go up in an airplane and your ears plug up. That's that eustachian tube kind of working there. These types of hearing losses can often be managed with medicine to clear up an infection or with surgery to fix problems there. This is the type of hearing loss that accounts for about 10% of hearing losses. Lots of these types of issues are pretty common in little kids where they get a lot of ear infections, hearing's affected, things like that. What's more common is this inner ear kind of hearing loss, which is called a sensory neural hearing loss. This is when those cells in that inner ear aren't working as well. So here on the top, this is kind of an actual image of what those hair cells in the ear look like. This is what they can look like when they've been damaged. So you can clearly see they're not looking like they should. And usually then that can be a cause of trouble hearing. This is usually a permanent type of hearing loss that can't be fixed with medicine or surgery. And that's where things like hearing aids may come into play. This can be caused by lots of different things. Most commonly, it's an age-related change, which is actually called presbycusis, where just oftentimes it's those higher pitched sounds that get harder to hear. Just over time, the way the sound travels through the ear, it tends to hit those higher pitched cells first, and they kind of wear down over time. You can also have hearing loss from really loud noise exposure. We see this with people who work in factories around a lot of heavy equipment, farmers, people who shoot a lot of firearms, musicians. They may have some hearing loss just from noise damage. There are also certain medications that can cause some hearing loss. Usually these are the big medications, like certain cancer medications, really heavy antibiotics. Trauma to the ear, whether it's an injury, whether it's some kind of radiation. Certain diseases like diabetes or certain cardiovascular problems can affect the ear, as well as different genetic factors. Some of us are just more predisposed to developing hearing loss, especially if our parents and our parents' parents also developed hearing loss. Different anatomical factors can play a role too, whether it's you're missing parts of the ear, whether there's a growth or something affecting the ear. Those things are less common but can happen. And sometimes we don't know why the ear has hearing loss. There's not always a great way to pinpoint exactly where it came from, but it's usually a combination of factors. The last type type of hearing loss is called a mixed hearing loss, which happens when you've got some inner ear hearing loss and some hearing loss in that outer ear. So maybe you have some age-related hearing loss and an ear infection, and there's wax blocking your ear. Then you've kind of got a double whammy going on there too. So how do you know if you have hearing loss? Some signs that you may notice, or that others around you may notice, is that you're just having trouble hearing things that you used to be able to hear. Some big things people tell me when they come in is that I can't hear when I'm in a restaurant, or I'm in a noisy place, or we're at a big group conference, where there's lots of background noise. I can't keep up with the conversation as well as I used to. We also hear maybe when there's a distance between who I'm trying to listen to, like maybe in church if there's not a microphone, or if I was talking here without a microphone, it may be harder to hear, especially if someone's not facing you. If I'm sitting here talking like this, it's probably a lot harder to hear me than when I'm talking facing you. This was a huge issue for people when we were all wearing masks during COVID. That brought a lot of people in the door because they realized, I can't hear you when I can't see you. People usually notice higher pitched sounds are harder to hear, whether it's speaking to females tend to have higher pitched voices. Young children tend to have higher pitched voices. Young children also don't speak as clearly as we would like, so that's even harder to hear. Television and phone calls can also be hard. People notice that using the captions has become more necessary than it used to. You're turning up the volume louder than maybe your family members prefer. You may also notice you have some tinnitus or tinnitus, which is a sound in your ear, whether it's ringing, buzzing, humming. That can be a sign of some hearing loss. Difficulty with even small group conversations, one-on-one conversations. Having to ask someone to repeat themselves multiple times. Saying, what did you say? Huh? Can you repeat that? Mishearing conversations where you think they said one thing and they said something different. Oftentimes people tell me, I heard you were talking, but I didn't understand exactly what you said. You may feel like people are mumbling. Sometimes they are mumbling. Sometimes it's that they're harder to hear. And finally, if you notice that you're withdrawing from conversations because it's hard to hear, you ask someone to repeat themselves, you're not getting it, so you just say, forget it, no need to hear them that bad. Things like that are all signs that maybe there's some hearing loss. So why do we care? Why do we care if you have hearing loss? Some of these things you may have experienced, or you may have had family members experience. There are lots of different effects of hearing loss. A big one is just the physical side of it, that your brain is now having to work much harder than it used to hear. It used to be easy. You would just hear somebody talking, have a conversation. You didn't think about it. Now your brain is working twice as hard to fill in the gaps of what you might be missing. So that increased cognitive load. Some of these things can even lead to increased risk of falls or higher stress, fatigue, you're tired, that ringing in the ears. Those are all things that can stem from some hearing loss. People have probably heard, or they usually ask me about, well, I have heard that hearing loss can cause dementia. And while that's not exactly a one-to-one relationship, that risk of you have hearing loss that you're not treating, you're not using hearing aids, so it's harder to hear. So you're working really hard, you're withdrawing from conversations, you're becoming isolated. That is a bigger tie to cognitive issues, that withdrawal. You're not socializing rather than the hearing itself. So kind of an indirect link there. There are studies that suggest that, there can be that link between cognitive issues, difficulty hearing. Emotionally, you may feel frustrated, angry that you can't hear your loved ones. Your loved ones may feel frustrated that that you can't hear them. You may become, people get irritable, they get sad. It's hard when you can't communicate as well as you'd like to. And it's frustrating for both ends. You're frustrated because it's hard to hear. Your family members are tired of repeating themselves. And it kind of just, this communication breakdown can kind of take place. This then can lead to some of that withdrawal, that isolation, the loneliness that we talked about, where it's too hard to go out and have brunch with my friends because I can't hear them, so I'm not going to go anymore. So if you think you have trouble hearing, what do? When should you see an audiologist? Anytime you're noticing trouble hearing, come in for a hearing test. Even if you're not having trouble hearing and you're just curious, do I have hearing loss? If I want to get a baseline of my hearing, might be helpful to have a hearing test. If you're having any of that ringing or buzzing in your ears, that also could be a sign that there's maybe some hearing loss. If you're having issues hearing in just one ear, or you always have ringing in one ear, your ears hurt, they're feel plugged, they're draining, those are things that you may need to see an audiologist as well as an ear, nose, and throat physician, just to make sure there's not something medical causing hearing loss. If you ever experience a sudden drop in hearing, you wake up one day, you can't hear out of one or both ears, don't ignore this. You should be seen for a hearing test immediately. Rarely there can be these sudden changes in hearing. If those happen, there's some treatment, but it's very time sensitive within a few weeks. So that's just my public service announcement. If you lose your hearing quickly, don't ignore it. Don't hope it will get better. Come in and have it checked out. If you come in for a hearing test, which some of you may have done before, a couple different things will happen. You'll meet with an audiologist. You'll spend some time talking about your hearing, saying, okay, when do you notice trouble hearing? Asking you about ringing in your ears, other symptoms that you're noticing. And then the audiologist will take a look in your ears just to make sure there's not wax that's causing any hearing loss, make sure there's no infection, anything like that going on. And then we'll do the hearing test. When we do this, we put some headphones or some little earphones in your ears. We give you a kind of Jeopardy button, and we have you push the button whenever you hear beeps. Sounds easy, but hearing tests are harder than they look. I'm looking for the volume where you can just barely hear the sounds. So they start pretty easy, and then you start to imagine the beeps. You think they're there, you think they're not. I call them the phantom beeps. So sometimes I'm not playing a sound and someone's hit the button and I have to say, okay, just wait. So we look for that spot where you can only hear the beeps about half the time. So it's truly the softness you can hear. We do some other tests where we test your word understanding, where I make you repeat back a bunch of random words like boat, ship, hat, things like that. And we're playing those at a volume that's more comfortable. And we're looking to see when you can hear the sounds, are they clear? People sometimes mix up those really soft sounds. One of our words that's a tricky one is wreath, like a Christmas wreath. We often hear wreath or reach, things like that. Just looking for, can you distinguish those sounds? We may also do some extra tests where we take a measurement of how your eardrums are working. We can measure some little muscle responses from your ear, things like that. And then we talk to you about what we found. Has anyone seen a graph like this before? This is an audiogram. So this is how we test your hearing. What we do here is we put the quietest sounds you can hear on this graph, plotted from the low pitch sounds, the really bassy, deep sounds, over to the high, kind of treble, squeaky sounds, like piano keys across the top. And then we have volume plotted this way. So very, very quiet sounds are up here at the top. Very loud sounds are down here at the bottom. Sounds down here are in the range of airplane engines, firearms, really loud things. Sounds up here are very soft, leaves rustling, things like that. We test each different pitch and we plot them out like this. Here the red circles are your right ear. Red, right, round is how we remember which is which. Left ear is the other one. It's the blue X's. So this is an example of a pretty common pattern of hearing loss that we might see, where somebody has pretty normal hearing in those low tones, and then it starts to slope off to some high-pitched hearing loss. In this case, it's a little bit worse in their left ear. So the way we would describe this is I'd say this person has normal hearing in the low sounds with some mild, sloping to moderate hearing loss in the right ear, and more moderate, sloping to profound hearing loss in the left ear. So this person is probably telling me, I can hear that you're talking, but I miss what you're saying. Or I can't hear my wife, I can't hear my children, I can't hear my grandchildren, things like that. Noisy places are probably hard. Because what this kind of oval banana looking thing here is that's the speech range. So at an average conversation, this is where most of the speech information falls. So anytime your hearing is below that, you're missing different speech sounds. So this person's probably hearing the deep vowels, the ah, oo, e, but they're probably missing those sharp clarity sounds, the sh, s, which makes understanding more difficult. There can also be a wide variety of types of hearing loss, where maybe you have a flat, all of the sounds are hard to hear. Maybe it's down here, maybe it slopes. This is just kind of an example of a common one we might see. So after I do this, I show somebody their hearing. People usually go, okay, so do I need a hearing aid? And there's not really an answer that I tell you yes or no. Because I don't know what your daily life is like. As a rule of thumb, anytime your hearing falls below this range, in this mild or lower, you could benefit from hearing aids. How much it might help depends on a lot of different things, like how much are you bothered by your hearing? Do you notice trouble hearing? Sometimes people come in and they say, I'm fine, my spouse wanted me to get my hearing checked. That's a little trickier of a conversation, because sometimes I say, okay, so you do have some hearing loss, and that's not what you want to hear. You may think you hear just fine, you don't want hearing aids, you're not going to wear them, you're going to put them in the drawer. In that case, they may not be helpful. If you're not going to wear them, why get them? Other times, you come in and you're really struggling and you're ready to make that jump. So then hearing aids are likely more helpful. Lots of different kinds of hearing aids, as some of you may know. Lots of different styles, lots of different companies, lots of different colors. They can be tiny, they can live way deep in your ear. They can be bigger, sit behind your ear. These are a little bit of an outdated photo. I think the ones now look a little bit sleeker, a little bit smaller than this. Lots of different options. What works best for you depends on a couple different things. What your hearing looks like, and what you like. Do you want something in your ear? Do you want something behind your ear? That sort of thing. And that's something that the audiologist can give you lots of information about. We usually schedule an hour-long consultation where you just talk about this. Lots of companies, lots of things to consider here. Usually people ask me then, okay, do I just need one or do I need two? Generally, if you have hearing loss in both ears, you will do better with hearing aids in both ears. Our brains work best hearing together. So while sometimes people may choose to just wear one, just wear the other, most of the time we recommend you try two and see. Anywhere you get hearing aids in the state of Minnesota, you are legally required to get a trial period or a return window. Minnesota, that's 45 days, where you can get the hearing aids, wear them, and decide for yourself. Do these help me enough to be worth keeping and wearing? So if you're on the fence, there's really no risk of trying them. Depending on where you go, you may get, kind of like if you return them, sometimes there's a few $100 fee that you lose out on just for the time, but they can be kind of pricey pieces of equipment at times, so you want to make sure you're sure before you get stuck with a device that's going to sit in your drawer. There are also options called cochlear implants. This is something that is actually surgically placed in that inner ear. In that cochlea, a little wire gets put. This is an option when someone has a lot of hearing loss that hearing aids are no longer helpful. We can turn up the volume to the max on the hearing aids and they're not helping. You still can't hear, you still can't understand. Then we can move towards something like this, where it just changes the way you hear. You're no longer hearing through those sound waves, you're hearing through little electrical impulses. So things sound very different, but this is usually something that we go down the road of once we get down to that profound, that severe range of hearing loss. There's also something called a bone conduction hearing device. This works well for people who have those conductive type of hearing losses, where your inner ear is normal, but the sound can't get through the ear canal, the eardrum, those types of things. Where this is surgically placed and it kind of vibrates, sends that sound through the bones of your skull. So this is less common. Sometimes little kiddos have these if they have a lot of trouble with this inner, outer middle ear space. Whether you have hearing loss or not, good communication is helpful for everyone. Here's kind of just some things that, some of them seem obvious, you may know, but some of them are things you maybe haven't thought of. Whether you have hearing loss or whether you're talking to someone who has hearing loss, always try to get someone's attention before you just start talking. People come in and they tell me, well, my spouse tries to talk to me while I'm in the other room and I can't hear them. I say, I can't either. That's a hard situation. Or someone tries to talk to me while I'm doing dishes and the sink is running. That's hard too. What can help is getting your attention first. We're all really in tune to listening for our own names. Whether I'm busy doing something else, if someone says Madison, or something that even sounds like Madison, we all kind of perk up. If someone call me, someone should get your attention. Call your name. Get you ready to listen before you just start talking about something random. Like we said, talking from another room or with the sink running is hard. So try to face the person you're talking to. Whether they have hearing loss or not, this is helpful. Try to stay within a few feet. Don't try to yell from across the yard, across the house. We all do it. I tell people all day not to do this, and then I go home and I do it. It's a hard habit to break. So kind of a compromise is if I want to talk to someone, I maybe say their name and then go meet them somewhere. Meet them in the same room, then talk about what I want to say. Turn off the TV while you're talking. How many times people say, well, I'm trying to watch my show and someone's talking to me. I can't hear two things at once. Wait and mute it during the commercials. Have your conversation, things like that. Good lighting helps when you can see. You can usually fill in. Some of those really high-pitched sounds, even if I don't make any sound, you know if I'm saying without me even making a sound. We all lip read a little bit, whether we mean to or not. So when you have good lighting, you can see my face, that helps fill in some of those sounds that you may be missing. Talking in small, one-on-one conversations is easier than big groups. You can also always just stop and ask somebody if they heard you. You know, you don't have to constantly say, you hear me? Do you hear me? Do you hear me? But you can just check in and say, did that make sense? Did you catch that? Not constantly, but enough just to make sure. Always helps to involve who you're talking to. You don't want to just talk at someone. Talk to someone. That's a good way to kind of make sure everybody's on the same page. You're having that conversation. You're not just lecturing somebody like I am to you now. Repeat yourself. How many times have we all had someone we've asked to repeat themselves 100 different times and we're just not getting it? That happens to everybody. What can help is if someone's asking you to repeat yourself once, they still don't catch it, rephrase it, what you're trying to say. Just say that in a slightly different way can help someone piece together, oh, that's what it was. That can be helpful too, is instead of you always saying, what? Say, can you rephrase that? Or can you say that differently? That can help you kind of fill in what maybe you were missing. Review at the end of a conversation. You've had an important conversation, make sure that you're on the same page. Say, okay, so maybe you talked about your dinner plans for tomorrow night. Before you leave, maybe say, all right, we're set for dinner at this place at 6 tomorrow. Just make sure everyone's on the same page. Can also help to let somebody know before you're going to change the topic of conversation. Our brains work a million miles a minute. We think of something, we immediately want to tell somebody. We're talking about what we had for breakfast, and I start talking about the baseball game I went to yesterday. You're going to take a second to think about, okay, what? What are we talking about? So what I could do instead of just jumping in is you say, oh, I want to tell you about the baseball game I went to yesterday, and then start talking about it. Something to clue the person in that you're changing your conversation can help. Get your brain ready to think about different words. If you're in a situation that's really hard to hear, you can always write down things. If you're in a noisy place, you just can't get something across, write down what you said. Type it on your phone. That can help too. We talked briefly about tinnitus, ringing in your ears. This is very common. Lots of people have this. Lots of people have it come and go, kind of randomly. Some people have it all the time. If it's there all the time, sometimes it's just there. You learn to live with it, doesn't bother you. But for some people, this can be very bothersome, where it's hard to sleep. It's hard to work. It's hard to focus because your ears are making noise constantly. This is usually that symptom of hearing loss. There's not a medicine or a surgery to get rid of this tinnitus, this ringing. Places like to advertise that if you take this supplement, your ears will stop ringing. I would be very cautious of that. There is not research that says that anywhere. What can help? Hearing aids. Because it's given you other sounds to listen to. Now that ringing, that buzzing is not as noticeable. It can also help to play some sound, whether it's a white noise, whether it's a fan, ocean waves. You can't sleep because your ears are ringing, turn on some other sound, help to mask it a little bit. There are also options for different kinds of therapies that can help people when that ringing is really bothersome. Earwax. People always ask me, how am I supposed to clean my ears? Usually you don't have to. Earwax is normal. It's actually there to protect the ear. It prevents foreign things from getting in there, prevents infection. It's usually not a problem until it blocks your ear. Then you should try to see either your primary care doctor, an audiologist, an ear, nose, and throat provider. They can take that out for you. They either can use some water, flush it out, they can pull it out, they can use some suction, kind of help clear it out of there. There are some options to try to take care of it at home too. Do not use Q-tips. We all want to. You look at the Q-tip box, it even tells you, not for use in ears. All this does is it pushes that wax in there deeper. Your ear canal is about this long. It's not very far. A Q-tip can easily fit past that. You risk hurting your eardrum. That earwax is only made in the outer third of your ear. If you push it in there deeper, it can't come out by itself. Outer third, it comes out on its own. What you could try instead is just tilt your head, let some water run in there in the shower. Helps kind of flush it out. If it's really stubborn, sometimes softening drops, oils, things like that can help loosen it. But if you're really having a problem, see your provider. See if they can get it out without being uncomfortable, without causing any damage. Got one more tidbit for you, just since I work in that vestibular balance section. The inner ears also sense motion. They have these vestibular systems that sense as you're moving. So sometimes patients feel dizzy, which can be a spinning, lightheaded, heavy-headed, you're woozy, you're rocking, swaying, you're off balance. Sometimes that can actually be coming from the ear. An audiologist can also do tests of your vestibular balance system to see if that's the case. If it is, sometimes there are things to help fix it, sometimes there's some therapies, but that's kind of my tidbit since I work in that area too. too. If you're dizzy, don't ignore it. Check in with your provider. See if a vestibular test will be helpful for you too. What questions do we have? We've got a microphone we can pass around too, so we can all hear.
One thing I think we forget in our conversation is that we can talk slowly and deliberately. It makes a big difference if you do it that way.
Absolutely. Don't yell at somebody when they can't hear you. Speak slowly, speak clearly. That makes it much easier than when you're just raising your volume at somebody.
I've noticed that when people tune into their phone, they become deaf immediately. So, is there what's proper nowadays? Is it, or should you just not talk to somebody when they're on their phone, or how are we supposed to do it? This is a new thing.
Yeah, it can be tricky. I think that can happen with the phone. It can happen if you're reading. Anytime your attention is on something else, you're not paying attention to what somebody's saying. That's another time where saying someone's name, something to get their attention first can help. Then, someone's like, oh, okay, someone wants to talk to me, let me look up for a second, hopefully. If someone's just ignoring you, they can hear you, that's a whole other issue. They're just being rude. Get their attention, try to get them to, if they hear you but they're choosing not to listen, do you really want to have a conversation with them anyways?
Can you explain, I know it's probably not easy, but there were so many different types of hearing aids. What exactly is a hearing aid trying to do for you?
Yes, good question. So hearing aids, the goal is not to fix your hearing. It's not to bring it back to normal. But what they do is they kind of help amplify or just increase the volume of things around you to make them easier to hear. So again, they're not perfect. Even with hearing aids, people may still have trouble hearing, especially in those noisy places when you're not facing someone. But they give you better access to sound. They take those speech sounds that you're not hearing normally, and they boost the volume to where you can hear them better. Lots of different options, styles, things. They all have the same goal, which is to improve the hearing. Some of them work slightly differently than others, but that's kind of the big thing. And it's not a hearing fixer, they're a hearing aid. They're to help, but they're still not perfect.
I've had hearing issues most of my life. I had ear infections when I was a young child. No penicillin at that time to take care of it. But anyways, in the early mid-60s, I had a stapes surgery. It worked great on the operating table, but it didn't work afterwards. And then in the mid-70s, I had what they call a TORP.
Okay.
And that worked for many years. I had to have that done twice because the TORP device turned out after the healing process from surgery turned out to be too short. So he went in and redid it.
Okay.
So that worked for many years, but now I think that device is kind of shifted, and it doesn't help me at all anymore for about the last 3 or 4 years. So I am deaf in my left ear. So, but so now you briefly touched on it. Am I okay now? You briefly touched on it, the Baja. Okay, I've been considering that for a few years, but I haven't stepped forward to have that done. And I did watch because of my attending this session, I found a YouTube video by Mayo doctor Matthew Carlson.
Yep.
He did so it was like a 7-10 minute video on the actual surgery.
Okay.
There wasn't anything afterwards. So my question to you now, it sounded like when you go back after the healing process, which takes a couple of weeks, but they don't actually put the Baja on for several weeks. Are you involved in that process?
Right, so I personally am not, but any of the hearing aid providers are. So kind of what we're looking at here is that torque you're talking about, what that is it's kind of a replacement for one of those bones in the ear. That can sometimes help with hearing permanently, sometimes temporarily, like you said. What the Bajas or those bone conduction hearing devices will help with, like you said, is they kind of give you sound a different way. They bypass that part of the system that's not working. You're right that usually there's the surgery and then we can't put that actual device on right away. We need things to heal first. But there are definitely at Mayo too, those same hearing aid audiologists work with those. I've worked with them in the past. If you're on the fence, there are options to try a Baja device without surgery. They can wear it on like a headband or things like that. So not a great long-term solution. You could try it to see if it helps. Sometimes that's helpful. Sometimes the hearing aids also work just as well in those cases. To kind of see what may be best for you, that kind of thing. Does that answer your question?
Yeah, somewhat.
Yeah.
You said that, and I have done, I did see Dr. Carlson
Yep.
about 3 years ago.
Okay.
And the audiologist, I don't remember her name.
Yeah.
But, I did, use that, bone conduction
Kind
pad,
of tried it, yep.
but they wouldn't let me take it out of the clinic.
Ah.
I wanted to take it. So, getting back to the device that, you, attach to the bone, is that programmable?
Yep. Yeah, so it's kind of like a hearing aid, that it's programmed, adjusted based on your hearing.
Okay, so it's solely programmable through the, by someone like you, or can I adjust it like a hearing aid?
A little bit of both. So
Okay.
most of the adjustments are made.
Oh, okay.
Most of the adjustments are made in the office, but like your hearing aids, you may have some control on your phone and like volume, things like that.
Okay, thank you.
Yep.
If a person has high frequency hearing loss, can the hearing aid be tuned to amplify only high frequency and not all background noise?
Yes. So if you have normal or near normal low pitch hearing, the hearing aids can just tune up where you need it. You know, you'll still get some degree of the background noise. Hearing aids have noise reduction, but no noise elimination. But usually, yeah, they're very fine-tuned based on your hearing.
Could you talk to the state of the art of the technology, what's new, what's different, what's coming, what you anticipate? And how do you recommend, or what do you recommend from your experience?
Yeah, so as far as kind of hearing aids, they change all the time. There's usually a new model every year. You know, going year to year, there's not always a huge difference. But what has been improving is the noise reduction is better to help make people hear better in background noise. A lot of them can even connect to your smartphone. You can hear your phone calls. You can stream music through the hearing aids. Things like that are the bigger changes. A lot of them are rechargeable now, so you don't have to put the little batteries in. You can plug them in at night. There's lots of different companies. I do have some information about kind of hearing aids, some packets if anyone's interested, that talk a little bit more about the specifics of some of that. But if you're curious, a hearing aid consultation is that time where for about an hour they get into the nitty-gritty, the specifics of what's out there. But big takeaways, I think the devices are getting smaller over time. They're getting more comfortable, and the sound quality, I think, is improving over time too.
Yeah, hi Madison, Chuck Beatty. Actually, I was one of the otolaryngologists at Mayo for about
Okay,
41 years and
Yep.
retired.
I've seen your name on charts.
Yes.
Yep.
So, nice job. It's a big topic to try to cover in 40 minutes or whatever, and you did a very, very nice
Well,
job
thank you.
of doing that. I just would make one comment. Over the years, I mean, there was sort of this common saying, you know, everybody says, well, I don't want to get a hearing aid, it's too obvious, you know, and the thing is, actually, the hearing loss is more obvious than the hearing aid. So,
Yep, I agree. Most often people tell me I don't want to look old with the hearing aid. You look older when you're making people repeat themselves a lot, so that can help.
Before we have to finish, I want to just make one comment, because I've worn hearing aids for about 14 years. And I'm a very social person. I enjoy being with people, especially groups like you. And I want to be able to hear what's going on and be with people. But the problem with hearing loss is it wears you out. It's very tiring to try to concentrate on hearing, especially when you're in a group. And the other thing is you'll have a tendency, I think, to more isolate yourself. You want to shy away from people because it's difficult. And that's hard work when you're hard hearing. And so there's a tendency to want to be by yourself. I find myself that I read more books than I ever thought I would read before, just because it's easy and I don't have to worry about hearing. And
I just want to lift up the fact that Zumbro's been proactive. In the last 10 years, we've put loops in this room and in our sanctuary for people who have hard of hearing. It wasn't until I started wearing hearing aids 10 years ago that Chuck became a much better physician.
And with hearing loss, are you not killing brain cells? I mean, there's the cognitive situation, the relationship between it. So really, truly, it's very important to take care of your hearing.
I agree, yeah. You know, the hearing loss itself isn't what's going to harm the brain, the cognition, but like you were saying, more the effects of it. It's hard to hear, you isolate, that can be more damaging to kind of the rest of the brain. So I agree, very important to kind of protect your ears. If you are around noisy places, wear those earplugs, and then keep on it. Get your hearing checked, find out where you're at, and if you're a hearing aid candidate, try them. See, do they help you? Make that decision for yourself.
I just want to comment that I recently got rechargeable hearing aids, so I don't need my batteries. I had a whole bunch of them. And so they're sitting up where you put the glasses for Lions. If anybody needs batteries, they're free. Just take them.
What size are they? 322. Oh, they're 312.
312 batteries.
I got a big one.
I think those are the brown ones, right?
Yeah.
Okay.
all right. Well, thank you very much for being here.
Yeah.